to do our cardiac SCD. So my patient is already in bed. I've already put her in her 30-degree angle. She's got her patient profile script. I have my nurse profile that matches, and I'm going to begin. So step one, the first thing I'm going to do is I'm going to review my patient chart. I'm looking for anything relevant to the cardiac or peripheral vascular system. So I learned that my patient has felt his heart racing with subsequent dizziness and wants to get it checked out. And I look at my vitals and I am tachycardic and I have a fever. And other than that, everything is normal. The next thing I'm going to do is perform my hand hygiene. I'm going to introduce myself to my patient. So hi, my name is Paula Simpson. I am a first-year Georgian College nursing student. Can you please tell me your full name and date of birth?
My name is Clark Kent. I was born 10/11/2004.
Excellent. So my patient is 21. The next thing I'm going to do is explain my procedure to my patient. So I'm here to do your cardiac assessment. There's 3 components. So I'm going to be having a look at your chest and your limbs. I am going to be feeling for your pulses and temperature, and then I'm going to be listening with my stethoscope. Okay. Any information that we collect here today is going to be kept private and confidential within your electronic health record. And do I have your consent to proceed?
Yes.
And I just want to remind you, you can revoke that consent at any time. Awesome. Do you have any questions before we start?
No.
So I'm going to start with my subjective assessment. So this is all of my questions. So first one, do you have any chest tightness or discomfort or pain?
Just what?
You're going to answer
no.
me from your script.
Yes.
Your patient's going to answer based off of the information in your script. That's okay.
No chest pain, but I do have a heart racing feeling and I get very dizzy.
Okay. Do you have any new or worsening cough?
No.
And then any cyanosis or pallor?
No, I do not.
And for this step, I'm also looking at my patient. She is not cyanotic. She is not pale. Her fingers and her toes aren't. Do you have orthopnea, which is shortness of breath when you're laying down?
No, I do not.
Any dyspnea, shortness of breath on exertion?
No, I do not.
Do you have any new or worsening fatigue?
Yes, I've been feeling very stressed lately at work and have not been able to sleep.
Okay. And any edema?
No.
That's any swelling or puffiness in your hands or feet?
No, I do not.
Awesome. And do you get up once or more per night to go to the washroom to pee? Excellent. Now I'm going to move into my cardiac history. So my first question I'm going to ask, do you have any relevant cardiac history? Anything like murmurs, heart attack, stroke?
No, I do not.
Do you have any immediate family cardiac history? So same thing, stroke, heart attack.
Yes, I do. My brother had a triple bypass after a heart attack when he was 50.
Excellent. I'm going to just ask about some personal habits. Do you smoke?
A pack a day.
How much alcohol do you consume?
I drink a beer after work each night, sometimes more on weekends.
Okay, can you tell me about your exercise habits?
I exercise an hour a day at the CrossFit gym.
And how about your diet? What kind of diet do you follow?
For my diet, I try and eat organic and non-processed foods.
Excellent. Next, I'm going to do my OPQRS TUV symptom assessment. So for your dizziness and discomfort, can you tell me when that started?
Just a few days ago.
Awesome. And then anything make it better or worse? So provoke or palliate?
It happens usually more often when I'm at work and I'm feeling stressed, and it relieves itself after I leave work and try to relax.
Okay, and for quality, can you tell me what it feels like?
It feels like my heart's beating too fast and it's going to pound out of my chest and then my head starts to spin. It's not.
Okay. And then R for region of radiate, can you tell me where that pain is and does it travel anywhere?
No, it doesn't radiate, but the pounding of my heart sits right in the middle of my chest.
And then severity, on a scale of 0 to 10, how would you rate that pounding?
An 8 out of 10 when my heart's pounding.
And timing, does it come and go or is it there all the time?
Like I said, usually when I'm at work, but now it's happening more often.
And understanding, what do you think is causing this pain?
I think it might be stress related. I'm working really hard and trying to stay up late by drinking Red Bulls and coffee so that I can get ahead on my work.
Okay, and value. What are your goals?
I hope that whatever's wrong can be treated so I can go back to work soon. I'm a workaholic.
I think you are too. Okay, now I'm going to move on to my objective assessment. So because it's been a hot second, I'm going to make sure that I get consent again. So before I move into the inspecting, palpating, and listening part, are you still okay?
Yes.
To continue?
Yes.
Excellent. I'm going to do my hand hygiene again. I'm going to make sure my patient is at least 30 degrees. My alcohol swab. I'm going to clean the diaphragm and the bell of my stethoscope. And then I'm moving on to inspection. Do you mind just opening your gown just a tiny bit for me? So I'm going to have a look at your face and your trunk. I am looking for color, so my patient's not cyanotic, she's not pale, she doesn't look anxious, and she is not diaphoretic. Then I'm going to move on to the neck. I'm going to do my jugular vein distension. I'm going to pretend this is a pen light. So I am going to steal my patient's pillows. Have a relaxed back for me. Can you look just away from me? I'm looking for the sternocleidomastoid muscle. I'm looking for jugular vein distension, so a distension of the vein on top. Shine my pen light, looking for shadows or pulsations, and I don't see anything. Can you look this way for me? And I'm just assessing for the same thing on this side. I may or may not see a slight pulse from her heartbeat. That is normal, that is not JVD. Okay, the next part is chest. So I'm having a look, looking to make sure I don't see any heaves or lifts. So her chest isn't pounding, even though she might feel that on the inside. And then I'm gonna have a look. So at the point of maximal impulse, or the PMI, the fifth intercostal space mid-clavicular line. Do you mind just lifting up other side? Awesome, so it's typically right under the band would be, and I'm just looking for pulsations here. And I don't see anything. Thank you. And then arms and legs, I am looking for any signs of edema. I don't see any. I'm looking for color. There's no abnormal purple, blue hue, no blanching. I'm looking for, on my lower extremities, if we had leg hair, equal distribution of hair on the lower limbs. And then I'm checking for any lesions or ulcers. So I'm gonna have a look at the bottom of your feet. Nothing, just a peek at your heels. Excellent, thank you. The next thing I'm doing, I'm gonna move into my palpation component. So the first thing is to check cap refill. I'm going to take both of your middle fingers, hard height. At the same time, I'm going to blanch. And we're going to count how long for the color to come back. 1, 2. Excellent. Less than 2 is normal cap refill. I'm going to check on 2 toes. Toes are cold. 1, 2. Excellent. So that is normal. Then I'm going to palpate temperature. So I'm going to use the dorsal aspect of my hands. I'm going from distal to proximal, and I'm doing all 4 limbs. Nice and toasty. Your feet are chilly. Shins are warm. Thighs are warm. So cool limbs can be a sign of poor perfusion. And then I'm going to go on to palpating for edema, checking in 2 places. I'm going to use my thumbs on the pretibial area. I'm going to press. There is no indent. Top of the feet. I'm going to press. There is no indent. Because my patient doesn't have any pitting edema, I need to tell you, +1 is mild pitting edema, 2+ moderate pitting edema, 3+ is deep pitting edema, and 4+ is very deep pitting edema. Next, I am going to go on to pulses. So I'm going to feel a couple spots. I'm feeling them bilateral. There are 5. So I'm going to start with brachial. Just turn both arms out for me. Excellent. So both are regular and 2+, which is normal. If you have to find one side first, put your non-dominant hand there, then find the other, that's fine. Okay. I'm going to do the same thing with my radial pulse. Just rest your hands down. So comfy. Excellent. I'm feeling just long enough to be able to tell you that the pulses are regular and 2+. Okay. Next for femoral, I'm not going to use my partner, I'm going to show you on myself. So my femoral arteries are right here. They are regular and 2+. Next, I'm going to move to post tib. So with 2 fingers, I'm going to landmark. I'm going to find the ankle bone. I'm going to put my finger just behind it. Second finger. Excellent.
Okay, I'll take that.
Excellent. And they are regular, and I'll say they're weak. They're 1+. This doesn't necessarily mean it's an abnormal finding, they're just a little bit harder to feel. Okay, and then my last one, my dorsalis pedis, so the top of my foot. And landmark my first 2 toes. If I can't see the feet bones or feel them, I can have my patient wiggle her toes, and then I can see. I'm going to go about halfway up the foot, 3 fingers nice and gently on the top of the foot. So on some people it might be a little bit higher. Or it can be a little bit lower. Were you able to find yours earlier?
Linda came in and found it earlier.
Amazing. Let's see what this said. This foot is warm. Sneaky one. Okay, and I got it. So they are both regular, and I would give them a 1+ as well. Excellent. Now we are on to auscultating. So the first thing I'm going to auscultate is for bruits. Bruits are an abnormal finding. They're caused by turbulent flow, typically a narrowing of the carotid artery, can be from atherosclerosis. So for bruits, I'm going to listen on both sides. There are 3 places. I'm listening to the carotid artery at the base of the jaw, mid-cervical, base of the neck. I'm using the bell of my stethoscope.
Might help.
Just keep your hand nice and quiet. And just a note, I can hear your heartbeat in the background. It shouldn't sound like a pulse right under my stethoscope. You don't have to say that in your critique, but just so you know, when you're listening to your partner, you might hear that. The next thing I'm going to do is listen to your heart sounds. So this is my APE-TM. I'm listening for S1, S2. I'm going to use the diaphragm of my stethoscope. Okay. Make sure that you're using the left and right based on your patient, not your look. So I'm going to start with my aortic area. Make sure I'm on the diaphragm of my stethoscope. Now I'm going to landmark. So I'm going for the second intercostal space, right sternal border. I'm going to start with the collarbone. Feel for my first rib. Feel for my first intercostal space. This is my second rib right here. So my second intercostal space right beside. Right sternal border, second intercostal space, my aortic region. S2 is loudest here. My pulmonic region, my left sternal border, second intercostal space. S2 is still loudest. This is Erb's point, left sternal border, third intercostal space. Tricuspid, so we have left sternal border, fourth intercostal space. S1 is loudest. And then do you mind just lifting your breast again for me? And so I'm going to make sure I'm in my 5th intercostal space. This time I'm mid-clavicular. This is my mitral valve. Excellent. S1 is loudest here. While I still have the diaphragm, I'm going to listen for my aortic and pulmonic murmurs. Do you mind sitting up for me? Start with the aortic. So again, my 2nd intercostal space, right sternal border, having my patient lean into my stethoscope. No murmur on that side. And then my pulmonic, so directly across is my left sternal border, 2nd intercostal space. And there's no murmur there. Can you lay back for me? Now I'm going to be listening to all of the valves again, this time for murmurs specifically, so S3 and S4. I'm going to listen with the bell of my stethoscope. So all of the exact same end markings. Oh, my aortic valve, 2nd intercostal space, right sternal border. Pulmonic, left sternal border, 2nd intercostal space. Herb is not a valve, so I skip him. And I have my tricuspid valve, left sternal border, 4th intercostal space. And then can I listen to your mitral valve again? Do you mind lifting your breast for me? Again, I'm going mid-clavicular, 5th intercostal space, and I'm listening to my mitral valve. Okay. Now while I'm here, I'm going to have my patient roll onto her left side. A little bit more for me if you can. Now I'm listening specifically for the murmur, so presence of an S3 or S4. I don't hear it. S3 happens directly after S2, and S4 happens before S1. All right, so that's all for the assessment. I want to thank you for your time. I'm going to bring my bed all the way back as low as it'll go. I'm going to put my call bell in my patient's hand. I'm going to do my hand hygiene. And now I'm going to give my S-bar report. So for my S-bar, so situation. Hi, my name's Paula Simpson. I'm a Georgian College nursing student. I'm calling to give report on, or to let you know, about Clark Kent, born 10/11/2004, age 21. And I'm calling because Clark lately has felt like his heart is racing and gets dizzy. A little bit of background, so Clark has told me he smokes a pack of cigarettes a day, does consume some alcohol. He has described the feeling as, at max, an 8 out of 10, mid-chest, doesn't radiate. So that's 3 pieces of subjective data for my subjective assessment. Clark also told me something about a family member that I forgot to write down.
My brother had a heart attack and then had a triple bypass.
So that would be a good one to write down. Okay. On to vitals. So as part of my subjective assessment, I also have to include vitals. So my temperature is 38.4, that is febrile. My pulse is 101, that's tachycardic, very slightly. My blood pressure is 109 on 72, nice and normal. Respirate 18, nice and normal. SpO2 is 98% on room air, which is normal, and my pain is 0. On visual inspection, Clark appears quite well, not cyanotic, not pale, not diaphoretic. Palpation, all my pulses were regular, slightly weaker with +1 in the feet. And when I was listening, I didn't hear any audible murmurs or bruit. My recommendation, I think Clark and I have both identified that he's a bit of a workaholic, has extra stress at work, but just to make sure that everything's okay with his heart, maybe we can do an ECG and a social work consult for support. I'm gonna make sure that was less than 20 minutes, so that was 19 and a half, and we're finished. Ta-da.